Hi guys, my name is Azar. I'm Doctor of Physical Therapy. I'm here today to start explaining you some of the tips that we all having issues with the posture that it can help us to correct them. Today I wanted to talk about the spine. All of our spine has three curvatures. In the neck, as you can see, the cervical has a lordosis, okay, which means the concavity. The thoracic has a kyphosis, which is the convexity, and again the lumbar has the lordosis again, which is a concavity. They are normal, and all of us have that. So if we see these kind of convexity, concavity, don't get upset or don't be worried. They are normal, totally normal. The abnormal is when they are too prominent or too much more than what it should be, and we're gonna explain you how we can recognize if they are normal or abnormal. First thing in the spine is the bones and the alignments. The bone and alignment are very important, like the car. If your car has a malalignment, you have issues that one part of your tires, they can get more wear and tear than the other part. Body is the same thing. These guys are cartilages. As you can see, they are very cushiony, and they can protect our bones from getting in touch with each other and getting wear and tear. If they are not preserved, these cartilages are not preserved in the height, we're gonna be in trouble. If we have an alignment issue, these cartilages can be worn and torn in one side comparing to the other side, depending which side we get more pressure. And all of these issues can cause the nerve roots to be under pressure, which I can show you. The nerve root here, the nerve roots are these guys. They're getting out of the spine, they go to the limbs and help us with all the innervation. If we have some kind of pressure, then the nerves can be under pressure and we can have pain on our bodies and our limbs. In the neck, if we have that pressure on the spine and the neck, the pain and numbness and tingling can go all the way down to your arm and your hands, and you can get numb and dysfunction on the hands. But in the back, they can go to the legs, which we are not talking about the back right now. The neck is very important part of the spine. It can hold the skull, the weight of the skull, and then we have to preserve the tone of the muscles, both sides correctly, to be able to preserve that vital organ of the neck and cartilages without any issue. The weight of the skull is important. We are not telling that our skull is heavy, but we say that our skull can be heavier if we have a malalignment or bad posture. Another part of the neck is the muscles. The muscles can get tight and then can get loose. Both of them are bad. We should have a balanced muscle, which is not too tight and not too loose. Part of the muscles on the neck should be actually loosened up regularly and get massage. And another part of the neck muscle, they should be more firm to give us stability on the neck. And these are different muscles that we're going to talk about later in later sessions. Another part of the neck issues, they can be the postural issues. As all of us work forward during the day, the shoulder can go forward and we can get mal posture. And then we have to keep fixing it by bringing it back and bringing it into the neutral alignment. Sometimes we get so much stress and our shoulder can get elevated. That's another issue. We have to make sure that our shoulder are relaxed, not too elevated and not too forward. These two are our most important enemies in our posture, which we're going to talk about later. It's not all about the posture. Later on, they can cause pain and injuries even if we keep doing these postures without doing the postural corrections regularly. I want to end my video today, and then I don't want to get it too long today, and later on we're going to talk about these issues step by step, and we're going to talk about which exercises are important and which exercise we can do at home especially during that coronavirus time, that we all have more time at home to be able to prevent the injuries later. Okay, if you have any comments, please comment me underneath this video, and I'm gonna be talking about whatever you guys like. If not, I'm gonna keep continuing doing all of these subjects and then get you familiar with the postural issues and then correction. Thank you for watching.